Hello and welcome to the topic Aortic Stenosis in the Cardiology module. By the end of this topic, you should be able to define aortic stenosis, explain the causes and pathophysiology of aortic stenosis, classify aortic stenosis, describe the clinical features of aortic stenosis, outline the principles of management of aortic stenosis. Let's get started. So what is aortic stenosis? Aortic stenosis is the obstruction of blood flow across the aortic valve due to the narrowing of the valve lumen. Similar to other valvular heart diseases, think about possible congenital and acquired causes of aortic stenosis. Among the congenital causes are bicuspid aortic valve and malformed tricuspid valve. Calcifying processes that are common, especially among patients over 65, can cause valvular aortic stenosis. Rheumatic valvular aortic stenosis has become rare in industrialized countries because the responsible streptococcal infections are treated with antibiotics earlier on. Congenital forms of aortic stenosis also occur. This is how aortic stenosis is classified into 3 grades, and this is based on the area of the valve opening as well as the pressure gradient. We have mild, moderate, and severe gradings. The classic triad of symptoms in patients with aortic stenosis is as follows. Chest pain, where angina pectoris in patients with aortic stenosis is typically precipitated by exertion and relieved by rest. Heart failure, where symptoms include paroxysmal nocturnal dyspnea, orthopnea, dyspnea on exertion and shortness of breath. And finally, syncope, and this often occurs upon exertion when systemic vasodilation in the presence of a fixed forward stroke volume causes the arterial systolic blood pressure to decline. Physical examination will reveal an ejection systolic murmur which is classically seen in aortic stenosis, classically radiating to the carotids, and this is decreased following the Valsalva maneuver. This is because Valsalva and standing decreases venous return, decreases the ejection fraction, and finally decreases the murmur. Hyperdynamic left ventricle causes enlarged left ventricle due to hypertrophy. Pulsus parvus et tardus is another kind of pulse characteristics which is found in aortic stenosis. Here we find the pulse to be slow and late due to the delay in blood flow across the narrowed aortic valve. Heart sounds of valvular aortic stenosis. Importantly, take note of the second heart sound, which can be breath dependent and it may be cleaved paradoxically, especially with higher grade stenosis. ECG changes such as T negativity in V4 to V6 are attributed to left ventricular hypertrophy but can also be completely absent. Different levels of severity of valvular aortic stenosis can be measured using an echocardiography. The stenosis can be classified into mild stenosis where the valve area is more than 2 cm square, moderate stenosis where the area is between 1.1 to 2 cm square, and severe stenosis where the valve area is less than 0.75 cm square. Doppler sonography can be used for determining the flow velocity at the stenosis. Cardiac catheterization can provide information on the pressure gradient but is usually only used when other tests are insufficient. If asymptomatic, then observe the patient is the general rule. If asymptomatic but with a valvular gradient of more than 40 mm mercury and with features such as left ventricular systolic dysfunction, then consider surgery because cardiovascular disease may coexist. For this reason, an angiogram is often done prior to surgery so that the procedures can be combined. If symptomatic, then valve replacement is indicated. Balloon valvuloplasty is limited to patients with critical aortic stenosis who are not fit for valve replacement. The transcatheter aortic valve implantation or TAVI introduces a biological valve sewn into a stent through the femoral artery or transapical area. Currently, this process is only used in patients with a high surgical risk. Take note, a treatment with only medication does not exist. So endocarditis prophylaxis is no longer indicated. Aortic valvular replacement is the only effective method for treating aortic stenosis. Let's summarize. Aortic stenosis is the narrowed aortic lumen which leads to obstructed blood flow through the aortic valve during systole, commonly caused by acquired conditions like rheumatic heart disease, degenerative calcification, and endocarditis. Congenital malformations of the valve can cause bicuspid or malformed tricuspid aortic valve, causing aortic stenosis. Clinical features of those with aortic stenosis depend on the severity of the disease. Once moderate or severe, they may complain of chest pain on exertion, syncope, or come in with signs of heart failure. A typical slow rising pulse and ejection systolic murmur over the aortic area radiating to the carotids are appreciated on clinical exam. Echocardiogram helps with grading and classifying aortic stenosis. Treatment is ultimately surgical replacement for those who are symptomatic or asymptomatic with pressure gradient of more than 40 mm mercury across the valve. So we have finally come to the end of this topic. Thank you.